Hello everyone, I'm Dr. Chandrashekhar. I'm the Managing Director of Place Institute. Today we will discuss these topics in this webinar. So the first one we will discuss about is recent updates that about Maha report and Tylenol and vaccines and leucovorin. These are the hot topics right now. And after this, we will discuss about etiopathogenesis of the autism and the strategies for the prevention and management of autism, and the upcoming R&D efforts that we are doing in our supplies. We'll discuss in the last. So there is no need of introducing autism for the parents here, because everybody knows it's a disordered brain development, and it starts from the womb, and it is a lifelong disorder, and it is not reversible, and it is characterized by the communication deficits and social challenges and repetitive behaviors, and it is classified into mild, moderate, and severe, and there is no established cause and treatment for autism. This is the regular understanding of autism, and everybody knows about it. So the rise in autism incidence is the global concern now, and this rise in incidence started in 1970s, 80s. It was 1 in 10,000. Now it became 1 in 50. And in last 6, 7 decades, it has increased a lot. And earlier, there are no surveys or any reports before that. So first, we'll see why autism is occurring and how this medical condition is developing. Let's understand that one. Understanding etiopathology means it is study of understanding the causes and development of the medical condition. So recently, Maha report is released, and it's a document that released by the U.S. government. It's Make America Healthy Again report. The gist of the report is bioaccumulation of the man-made chemicals in the humans is the reason for autism and other global developmental delay and other developmental issues, and also all the chronic illnesses, starting from hypertension to cancer. All the chronic illnesses are also linked to this bioaccumulation of the chemicals. So this kind of study was done in 2005 itself, and it took 20 years for the Maha report to come. It came up after a lot of efforts by Kennedy and other people. So this body burden study was done in 2005, and they have seen 287 chemicals, man-made chemicals in the umbilical cord blood, which means from the mother to the baby, there is a cord through which the blood flows into the baby, and that is the nourishment for the baby. So in that umbilical cord blood, uh, they have demonstrated, environmental working group demonstrated 287 chemicals. So out of them are 180 are cancer causing, 208 are able to cause birth defects, and around 217 are neurotoxic. So, the placenta is not impenetrable, and all these chemicals can cross the placental barrier and enter into the fetuses. And the fetuses they have a immature blood-brain barrier and poor excretory mechanisms, poor detox mechanisms, and these chemicals enter into their body. When they enter into their bodies, they reach their brain cells, and they enter into their brain cells, and they start influencing the gene activity. Thereby, they impair many neurodevelopmental processes. And another thing they affect is the microbiome. So the microbiome, when the bioaccumulation of these chemicals are there in the mother's gut microbiome is affected. So there is considerable evidence that there are mother's gut microbiome metabolite vesicles are present in the amniotic fluid. So amniotic fluid is the fluid in which the baby develops. In that, there will be vesicles from the mother's gut microbiome, which contains those important metabolites. And also, evidence suggests that there is an important microbiome in the amniotic fluid. which is colonized inside the uterus itself. And this is crucial for their like entire developmental processes and overall health throughout their life. So when these chemicals enter the babies, this will not allow this microbiome to colonize in the baby's colon and also impair the mother's gut microbiome. So thereby they impact the neurodevelopment and overall immunity development as well. So this is the structure. I can this is the slide I can explain much better. So when these chemicals enter into the babies, they enter into the brain cells of the developing brain. In there in the brain cells, they influence the genes of the brain cells, cause epigenetic errors, and their activities become abnormal, and which results in impairment of many neurodevelopmental processes. And there's something called like microarchitecture is distorted. Brain's microarchitecture is distorted, which can be irreversible throughout life. So these chemicals also impair certain mechanisms where neurotransmitters production and every other functional aspects. So if you remove those chemicals from their body, that dysfunction can be reversible. And when these chemicals also disturb this microbiome, the mother microbiome and prevent fetal microbiome development, they aggravate the epigenetic errors. So so this is why we are more focused on the microbiome. So, so when these chemicals enter into the babies and they cause epigenetic errors, these are some of the epigenetic errors. Like we have discussed these epigenetic errors and mechanisms affected in detail in the previous webinars. One can take a screenshot and Google it also, all these things. So there are certain epigenetic errors like differential gene expression, like so the genes, their genes get upregulated, downregulated. That means the overactivity of the genes, underactivity of some of the genes, and something like differential alternative splicing, which actually abnormal gene activity, which results in the abnormal protein formation. And around 2000 mechanisms, more than 2000 mechanisms are affected during the brain development. So there can never be a single drug or a pure form of drugs or any medicines that can come and give you a complete recovery kind of thing. So recently we have seen the announcement of the leucovorin also. So in the leucovorin is a formal form of the folinic acid. It will definitely help the children with autism because it's a folinic acid helps in the DNA repair and oxidative damage. But it is not a magical drug that can cure autism. And please do not have that kind of understanding that it's a leucovorin is completely can reverse autism. It's only help. It will help in autism in combating to combat the oxidative stress and it will help in the DNA repair mechanisms. When these all these genes are dysregulated due because of the chemicals, there are 2000 mechanisms that go abnormal. Some of the key mechanisms like neuronal migration, accelerated neurogenesis, neuronal differentiation, and synaptic pruning, functional circuitry formation. These are the important mechanisms that are affected, which show which are the reason for the distorted microarchitecture. So, if you Google about these kind of this particular subependymal nodular dysplasia, heterotopias, and multifocal dysplasia in autism, we can understand what kind of abnormal structure formation is there in autism. So, after talking about the microarchitecture distortion, we have to talk about something which is reversible in autism, that is microbiome. So when these chemicals are accumulated in the mother, they disturb the mother's gut microbiome, and gut microbiome is crucial for the fetal development in terms of hormones, nourishment, and many things. And there is evidence that sorry before also we have discussed about the gut microbiome metabolites of mother are seen in the form of vesicles in the amniotic fluid. Those are all very crucial for the baby's brain development and overall fetal development. And in the first 1,000 days of the life, including the gestation period, that is pregnancy period, so microbiome develops in the human. So when chemicals are there in that period, this microbiome development is impaired, and there is a weak and susceptible. Children receive a weak and susceptible microbiome. So when the children have a weak and susceptible microbiome and are exposed to the higher antibiotics and vaccines, microbiome disrupts further, then children land up in the regression, because microbiome is directly linked with the neurotransmitter balance. When they lose that microbiome, they lose those neurotransmitter balance and they land up in the regression. So we often see these kind of biofilms in autistic children poop. So this is because of their phylogenetically different ecosystem, because of their microbiome is not good. They form biofilms like this. So they themselves cause lots of epigenetic errors by their metabolites, which enter into the blood circulation, and they impair gene activity in multiple organs, and they keep on suffering with multiple things. This has to be removed, and the new microbiome has to be replaced to avoid all the conditions. So these are the two important research articles published in the 2019. So this is this is a human study that is published in the Nature. This is done by Arizona State University. They have done microbiota transfer therapy and fecal transplant in 18 children, 18 participants, and they got good results in terms of GA symptoms and autism related symptoms, and which maintained after 2 years as well. And this is an animal study. This is also done by the same group. They are also linked to the Arizona State University. So they have done a pair of they have done an animal study. In this particular study, they have taken two pairs of germ-free mice. So in each group, the pair of germ-free mice means like one is female and one is male. In that, in one group they have taken poop from the autistic child, and they transplanted into that germ-free mice, pair of germ-free mice. In the another group, they have given poop transplant or fecal transplant from the neurotypical child, and they observed their babies. The babies that received gut microbiome from the autistic children, they exhibited similar kind of symptoms and metabolites and epigenetic errors in their brains, and they also like when they have done the autopsy studies also, they have shown similar kind of distorted brain microarchitecture in their brains. So they also this particular study demonstrated the entire pathology of the pathogenesis of the uh, autism. So, so this gut microbiome. Let's understand what is this gut microbiome. So, the gut means like this is an alimentary canal, starts from the oral cavity to the rectum. Uh, so, uh, this so there is a layer of microbiome, like it's a microscopic organisms that reside from the buccal cavity to the rectum on the surface of the mucous membrane. So they are important in the developing the immune system, digestion, absorption, and they also crucial in the hormones and enzymes and everything. So so what is gut microbiome transplant? When we do not have a good microbiome in our intestines, we have to take it from the other. So people try to replenish with the diet and probiotics. It most often, in many cases, it fails. So to replenish the entire ecosystem, like to transform the entire ecosystem, gut microbiome transplant can be utilized. This kind of practice is there in the veterinary science as well. We call it as rumen transformation in the veterinary science. And this particular like a particular treatment modality is not new. It is 2000-year-old, and it was there in the Chinese medicine as well. And now it is being getting popular in last 2 decades. Many conditions, like because of the chemicals, we are losing microbes, which cannot be replaced directly with any probiotics or something like that. So this is the only source. Other source is amniotic fluid, which is tough to get. So the poop is the only source for that. So if you are looking at very good recovery or possibilities, we need a good microbiome from the healthy donors. So this can be given with the oral capsules or retention enemas or colonoscopy. But colonoscopy approach and retention enemas are the targeting the direct target organ. But colonoscopy cannot be done on a daily basis. Oral capsules have their own problems like stomach acids and pancreatic juices will kill most of the microbiome. So it cannot colonize it will not reach the target organ. Even if it is reaching the target organ also, very less quantity will be reaching. Oral capsules cannot be given in high doses also. So retention enemas, I feel retention enemas are painless and it can be given multiple times so that the microbiome survives there because the existing microbiome has trained the immune system and that fights back the new microbiome that is being infused into the colon. So taking the poop from the healthy donor and infusing into the intestine of the affected people is fecal transplant or gut microbiome transplant. So like this, so retention enemas are done in, retention enemas can be done with a tube, simple tube, can be inserted into the colon, large intestine from the anus, and it is the solution prepared will be infused into the large intestine where those microbes get colonized. And this particular treatment is not only autism, it has helped many patients with inflammatory bowel disease as well. And we did not see much success with IBS, but we saw good result in the inflammatory bowel disease. And we have seen some cases of Crohn's, we have seen some result. And a few other cases, some psychiatric cases, and some other cases, we did not see much result. So though we saw some result, for some time we some of them regressed because maybe the diet pattern or something else. And even so, we even see that there it is bidirectional. When somebody is having psychiatric disorders, it is we try to do it from one side, and the other side from the other side it will be a problem. So sometimes, in some cases, we need to work on bidirectional kind of thing. So for autism and some of inflammatory bowel disease and post-cancer chemotherapy recovery, all these cases we saw some good result with this. So success of this particular treatment depends on the donor screening and process of the FMT. So donor screening must be done in a proper way. So when we are taking a donor, we must be careful about their overall health. The donor must be donor must have passed all the tests so that along with the routine health checkup kind of thing, we need to look for many infectious profile which can harm the recipient. So we have to some of when we are if you go back and see in COVID times, you can see if somebody is just 6 feet distance, also people used to get it through the aerosols. And when we are doing fecal transplant, we are infusing 100 ml, 150 ml of body fluid. It is highly chances of there is high chances of transmitting the infection also if the donor has the infection. So the donor is very crucial. Donor screening is very crucial in FMT procedures. So the world believes that high diversity is important and they take the adults, but I see much risk with the adults. So we are choosing young children, healthy children as the donors, and we test them with the international stool banking consensus guidelines. And we added something else called food intolerance test that we observed in our studies and understanding. So food intolerance test, it became like a litmus test for us. If somebody has food intolerance positive, they respond to the treatment. If somebody doesn't have food intolerance, they will not respond to the treatment. So even the recreation patterns are, if somebody is improving or somebody is losing microbiome also can be tested with the food intolerance test. If so, once FMT is done, uh, every quarterly, if you do the food intolerance test, if you see the declining pattern, they are improving. If you see the pattern is not declining, there is no response to the treatment. We need to see into the what are the other factors like bowel cleanse, proper bowel cleanse or dosage. Those are the concerns sometimes, which like success or failure of the treatment also can be measured with the food intolerance test. So our donors are usually less than 12 years, and so we make sure that their vaginal delivery and their so how often they like become sick, and how often they used antibiotics in their lifetime, and their overall personality development and their academics and everything, their personality. We evaluate everything, and we take them as donors. Most, at least if we test 20, 25 children, we get one or two children in that positive for donors. So, in the process of doing collection and process of transport and everything has to be meticulously done. So the collection of the stool from the donor should not be done in the restrooms. So this is the first rule, and it is the thumb rule kind of thing. Restrooms have lots of bacteria which can contaminate the stool there. So it has to be done in a hygiene room. It is in a dedicated room, and so we must follow some procedures for the collection, and I'll explain in the next slide how we are doing it. Then that particular collected stool also has to be maintained in a proper way to protect the aerobic and anaerobic bacteria and maintain the temperature, and should be transported, and has to be the cold chain maintenance and preparation, everything must be done in a proper way. So this is the food intolerance test. So this is the gut lining, and over gut lining, so there is microbiome here, like microorganisms are here. If we have a good microbiome, so this microbiome interacts with the immune cells here. This is inside the gut lining. There are immune cells. 80% of immune cells reside in the just beneath the gut, the intestine. So if you have a good microbiome, they will not report the food as antigens to the immune cells. If you have a bad gut microbiome, it will report immune cells. It will report our food as antigens to the immune cells, and there is a inflammatory response to the food. So this is a food intolerance is a good litmus test kind of thing to understand whether the child can be taken for the FMT or not, or even the response also can be measured with this microbiome. So so this test is crucial for selecting the donors, and even the you can even test the improvement or any regression. We can estimate the food intolerance test. So this is the process we follow in this place. So this is the microbiome collection, the stool collection. We do it in a specified room in the home, and it's a dedicated room. In that particular dedicated room, we give a sort of commode in which we will place a sterile sheet over which we place a sterile gamma sterilized food container in which the child passes the stool. And once the child passes the stool in that, so it will be like the mother will fill it with the saline so that the stool is submerged in the saline. So then that is it is like then an airtight lid will be placed and put it in the refrigerator in their house. So that will be transported to the center in 4 degrees centigrade. After that, we do a homogenization process and refrigerator centrifuge where we maintain the temperature and less air exposure so that anaerobic bacteria will not die. So then it is administered through the retention enemas. We evacuate the bowel of the children using saline washes and mute enemas, and we wash out the existing stool and that in their intestine, and the solution will be infused into the large intestine through the animal using a very thin tube. There is no need of sedation, or there is no need of restraining and everything. This particular treatment is shown in some good efficacy in autism, global delay, and some of the gastrointestinal disorders also like inflammatory bowel disease and other constipation issues. Some of the people, those who had issues with the enteric nervous system, they did not show much result. Maybe delayed result may be there. Some cases are failure are there. Many cases we have seen good improvements. Uh, and these are some of the lifestyle disorders also are like obesity, diabetes, cardiovascular disease, and other things also there which can be applied. But right now it is in the R&D phase, and very few people are trying in those conditions. And right now we are not taking all those obesity and diabetes cases, but inflammatory bowel disease case and autism and global developmental delay can be taken. And so there are many conditions like neurological and gastro conditions. It can be applied. This treatment can be applied. So for those who cannot come for gut microbiome transplant, because this particular treatment needs a longer course of treatment and a dedicated needs a lot of commitment and no, like it is not available everywhere also. So we have devised one plan called GutQuest. So this mainly works on the modifying their diet and giving a good particular diet pattern, proper diet planning. So we try to modify their gut using that gut quest program. So in this gut quest program, we are going to do a microbiome test. We are going to do a food intolerance test. With the food intolerance test, we classify their foods into inflammatory and non-inflammatory, which is customized for that particular patient. And then in that non-inflammatory foods, we select the low FODMAP diets. And in that low FODMAP diet also, we identify with that particular child has sensory issues, with with their food sensory issues and low FODMAP diet inflammatory patterns, we devise a balanced meal diet in the gut quest program. So this, along with that, we will supplement some important probiotics for them, which are customized according to their gut microbiome profile. So, and if they are lacking enzymes, that will be replaced, and other medications if they require for resolving their gut issues will be given in this particular program. So this can be a remote possibility if somebody is very far away and cannot come for the gut microbiome transplant or anything, that can be used. Another program we have developed is SmartLine program. So this particular program is mainly for autism prevention and global developmental delay prevention and genetic disorder prevention. This works the SmartLand programs work so we try to remove the chemicals before pregnancy, so that if the chemicals are not there in the mother's body, it will not enter the baby, it will not enter the baby's brain cell, and there is no question of autism. So if the chemicals are not there in the mother, so if you address the chemicals before pregnancy, so the children will not have autism. And some people might be debating that autism might be genetic in origin, but it is probably it is less than 1%. And if it is genetic also, the incidence rise should be proportional to the population rise. It should be proportional to the population growth. Those kind of, it is completely disproportionate with that, and it is incidence is rampantly increasing, and uh, and uh, and there is no consistency that so autism can be genetic. So there are some databases like SFARI, Simon's Spark, these kind of databases are there. They have done a huge study for the genetics in autism, and they found around 2,000 genes associated with autism. They are not causative; they are associated with autism, but none of them have less than more than 1% prevalence in autistic population. That means autism may not be genetic, but autism may be having genetic susceptibility, because if somebody has genetic susceptibility, if this microbiome and environmental toxins, uh, uh, so then it will be so those children may develop autism very easily when they have a genetic susceptibility. So in Smartland program, we address first environmental toxins. If they have a inheritance pattern, if so in the Smartland program, we test the couple for the genetic test, and affected child also will do the genetics. If there is no inheritance pattern, we look into the environmental factors. That these are the two environmental factors. One is the chemicals. The second is microbiome. And then we address with detox protocols and microbiome modulation for the mother, and maintain and guide them with the proper lifestyle throughout pregnancy, so that child will not be having problem in the second child. We can avoid autism in the second child. So this will be the Smartland program process, and we have discussed about the gut quest also. So these are the things that we are developing in autism, and so we have a comprehensive school program in our institute. If somebody is coming for a long course of FMT, they can utilize these kind of services. It's like a daycare and comprehensive school approach with all the therapies. So people can approach that one. But this is another. We are doing some upcoming R&D work, which is a novel research, and might be the first across the globe. So it can be a groundbreaking also in the future, and it will break the thought process that one's autistic and they are autistic forever. So why I'm saying this like this, because so when these chemicals enter into the brain, so they interfere with the gene activity, and distort the brain microarchitecture. So if we this how this these chemicals are interfering with those signaling molecules, which is impairing those brain cell growth or connectivity. So we will identify that particular thing, and a targeted delivery of signaling molecules will be given to specified regions of the brain to mature those neurons and improve the connectivity. This is expected to give a near full recovery at any age of the child. So we have seen these kind of structural abnormalities in the autopsy studies. So we are not going to address the heterotopias or subependymal nodular dysplasia, but we will focus on multifocal dysplasia. So in this particular thing also, you cannot recover 100%, but these particular multifocal dysplasias can be targeted. So we already started some in silico studies in the animal brains obtained from the slaughterhouse using molecular docking technique. We are identifying some of the signaling molecules, and so we'll be after this we will be doing some postmortem brain tissue studies in the autism and neurotypical children, followed by some cell line studies and animal studies, and then human trials. So then we'll identify those important signaling molecules which can be given a targeted delivery into the brain, the specific regions of the brain for the development of those regions. So this is expected to give a 70 to 80% recovery at any age. So I'll give you some list of you can see and you can note down the signaling molecules which are going abnormal in which are abnormally expressed in the neurodevelopmental process. And so these are some of the molecules like the sonic head shock, uh, morphogenic proteins, WNT proteins, and retinoic acid, and all these things. These are some of the important signaling molecules. And so these signaling molecules are for the growth and differentiation of the neuronal cells. Differentiation means as one neuronal precursor cell can become any type of neuron. There are multiple different types of neurons based on the region. So, like in speech area, different neurons are there. In language areas, different neurons are there. In auditory cortex, different neurons are there. In frontal cortex, there are different neurons. Based on the regional differences, there are different types of neuronal cells, and the location of the cells and the function of the cells. The different kind of neurons are there. This one neuronal cell forming different types of cells is called differentiation. This is guided by the signaling molecules. All the signaling molecules are going abnormal in the neurodevelopmental process because of chemicals. So by identifying those signaling molecules and by doing their brain mapping and everything, and doing a targeted delivery of these signaling molecules would improve their neuronal connectivity and maturation of the neurons in that particular region. So this has to be done in a meticulous fashion. Probably it will take 5 to 6 years from here. So these signaling molecules are required for the axon guidance, migration cues, and everything. So you can take the screenshots and Google about all these things. These are some of the neurotransmitters and neuromodulators. They are also required for the brain maturation. And these are some of the extracellular matrix and adhesion molecules. These are also going abnormal in the neurodevelopmental processes. So like this, there are around 2,000 processes affected, but some of them are very much crucial. So we are working on, we are trying to identify most helpful signaling molecules which can be delivered, which can be used for a targeted delivery to improve their neuronal activity. So these are our facilities. We have one facility in Manikonda, another facility in Patancheru. So this is our stool bank and specimen processing unit, where we have like we have a clean room facility kind of thing where we'll be doing the processing. Every processing is done in that particular sterile environment. So anybody who is having children with autism and suffering with gut issues and allergies can look for this fecal transplant. And if somebody is having problems like going for the second child and wants to avoid autism in the second child, can approach us. And if somebody cannot come for the FMT, they can approach us for the diet modification and probiotics and other guidance for the microbial modulation. So these are the services that can help your children. And thank you. If any questions are there, please ask.
Hi everyone. Thank you, sir, for the wonderful presentation. I'm hoping all the doubts and misinformation or all the information about the FMT was clearly communicated to everyone. Before proceeding for the question answer, anyone has any questions that they need to ask, sir, please one by one put it in the chat section. I will read it out to the sir and we will answer all the questions one by one. Before that, I'm glad I can see two of our parents who have joined us today. I would request one by one each of them to share their experience with us. First, I will be unmuting Miss Vishala. Her child is around 10 years old and she has come to our center with her child and taken the treatment from Sir. Miss Vishala, you can unmute yourself and maybe, share your experience. I'll do that.
Hi, Siksha. Can you hear me?
Yes. Hi, Miss Vishala. Thank you so much for participating today. We'll be really happy if you can share your experience with us.
Sure, it's my pleasure to share the experience. First, I would like to thank everyone who's listening to me. So, my name is Desala, and I have a 10-year-old autistic kid. He is a regressed spectrum kid who was a very normal neurotypical kid until age of 2 years, and he regressed due to vaccines and back-to-back antibiotics at the age of 2. He was quite talkative. He was very responsive with all the milestones on time. And unfortunately, we lost all the good things due to losing his microbiome. Just like any parent, I tried many therapies like speech therapy, occupational therapy, nothing worked for us. A few therapies like Nimichek protocol did work for 5 to 10%, but nothing came close to GMT or FMT, whatever the Dr. Chandrashekhar is doing it with my son. So I want to start with his gains because it has been just 35 sessions since we worked out, but yet we are seeing huge gains, especially with his food intolerances, with his speech, his response. He was never responsive after the age of 2. And of late, at the age of 10, he started responding back to us. Like if we ask a question or if we give him a compliment, wow, a new t-shirt, we see that smile and response, and the eye contact is unmatchable. It's fantastic. Even outsiders like my parents, extended family, the staff at Resplis, everybody could see that he started talking back. Another huge gain is him sitting through the therapies. So his sitting tolerance has gone from 10 minutes to 1 hour, which is fantastic for us, especially with the special education. So all through the special education class, he's sitting, his learning capacity has increased enormously. I can't say enough good things about the treatment. It had been just 35 weeks, but I'm quite happy. And again, this is not a paid review. Anybody who's interested, please do contact me. I'm a genuine parent, just like you are, of a special needs kid. And prior coming to Resplis, I had no hope that my son would ever talk. But now I have huge hope that he would have almost neurotypical recovery. I'm very, very confident about it because it had been just 35 sessions. And Dr. Chandrashekhar has recommended us for 120 sessions because our son's gut condition is quite bad. If I'm seeing these many changes after 35, I'm pretty sure after 100 sessions, I'm going to see a lot more. So thank you.
Thank you so much, Vishala. It is so sweet of you, and really thank you for all your feedback and everything. We have one more parent. Her name is Miss Nupur, and I request Miss Nupur to please share her experience as well before we proceed for question answers. Miss Nupur, can you unmute yourself?
Hello, hi, hello everyone. Thank you, Dr. Chandrashekhar, for the wonderful presentation, and thank you, Siksha. Yes, so I'm Nupur. I have a 4.11-year-old son, and as Mrs. Vishala mentioned, I have also tried everything, and my son was also a very cute little boy with all the milestones achieved on time. But he definitely had a lot of gut issues because he had a very poor sleep pattern, and then he had a leaky gut also. So whatever he used to eat or have, he used to just pass motion very frequently, as well as he was a very picky eater. He was only on mash and only liquid diets. So definitely I knew there is some gut involved. And when he was 1.5 year old, due to a lot of vaccines and a lot of antibiotics, and then he had COVID also, so all due to all those things, he had a severe regression, and then he stopped talking also. And he had all autism symptoms. He was not giving good eye contact. He was throwing a lot of tantrums, very uneasy always, and hyper as well, not understanding as per age appropriate. So as all parents do, I tried all the therapies. We started with all OT, speech, ABA, everything. We did it for 6 months, and then we knew that we have to try other treatment options also. So we have done everything. But last year, I was not aware about Dr. Chandrasekhar so much, but I was not aware that at first 3 months and for so long FMT can be done. I had tried FMT in Mumbai, but that was only one time, and which was done with a treatment. So one of the parent on Facebook shared his experience, and he told me there is a doctor in Hyderabad who does long-term FMT, and he has very good results. And that is how I got connected with Dr. Chandrasekhar last year, August. And we immediately after talking to him, the first thing we did was food intolerance test. Nobody ever suggested me to do that, but doctor did. And then we came to know that actually our son is intolerant to so many food items. And definitely his entire microbiome is affected, and that is the reason he's not able to cope up. So then we decided to go to Resplice, and we have taken around 75 sessions of FMT. The entire procedure was very transparent, very comfortable. Everything happened in front of our eyes. Dr. Chandrasekhar is very simple, very genuine, and nicely he explained us everything. The staffs were also very cooperative. They organized an apartment also for us to stay nearby. And there's a child development program where all the therapies were also taken care of, which was a plus point because I was worried if I have to stay in Hyderabad for 3 months, then my son will miss out on all the therapies, but that were also taken care of. They have a wonderful therapy setup, and all the therapists are very sweet and very nice. My son got very comfortable very soon over there. Even the GMT staffs were very nice. So after 3 months of completion of the entire FMT process, and then we followed the diet also and some supplements prescribed by Dr. Chandrasekhar. From March onwards, like after maybe 2 months of completion of the treatment, we started seeing real gains. So my son sleeps throughout the night now. He's no more a picky eater. He eats everything. He is so cooperative in the school now. I was so worried how will he was not at all cooperative in school last year, but this year from June onwards, he is going to the school and he's staying in the daycare also. So he's in the school for the entire 8 hours. I can work peacefully now. That's a huge progress for us. And his eye contact is almost 100%. The most important thing we noticed, and his all therapists noticed, that he has got self-regulated. He's very self-regulated now. His understanding has improved a lot. He has started his visual perception, his command following, overall his sitting tolerance has improved a lot, and his overall gut is doing well. Even his motions and everything is very much fine. So we are very happy with the treatment. I'm really happy. I'm glad that we took the decision to go to Resplice, and honestly it was very cost effective as well. And my only suggestion and request to all the parents out there is, please get the internal gut sorted. And definitely, gut is connected with the brain, and these kids are suffering a lot due to gut issues. And if we can sort this out, if we can take out some time, and I know 3 months sounds a big thing. Even we went for 1 month, but we started seeing good improvements within 1 month, and we started seeing how this can help. And we stayed there for 3 months. My husband was also not there with me throughout. I stayed there for 3 months, and there were very many mothers who were staying without their kids, and the staff was very supportive. So it was very comfortable. It is worth trying FMT, and we've definitely all the kids improve a lot in terms of sensory issues, sleep, cooperativeness. Then the tantrums issue, the hyperactivity goes down, sitting tolerance improves, which is very important for them. So they start focusing and concentrating. So for us, it has been a game changer. That's all from my side. Thank you so much.
Thank you so much, Ms. Nupur. It was really nice of you and sweet of you to share your personal experience. We'll jump to the question answers right now. I can see a lot of parents have written their questions in the chat section, so I'll just read them one by one. Doctor, you're there. You can unmute yourself and you can start the question answer. So you can start your video as well, so people can connect with you once you answer their questions.
Okay.
Yes, sir. Thank you. So first question is by Kalyani. She says, "Hello, doctor. How is brain mapping done?"
So this is not right now. There is no particular methodology for the brain mapping now. So we are looking into thought process that. So by doing some sort of psychological studies and in animal studies and previous databases, we are going to estimate that if somebody is non-verbal, somebody has echolalia, and somebody doesn't even comprehend. Somebody has like speech, but they never comprehend. Somebody doesn't have speech and they can comprehend everything. And based on their skill sets, and we'll have the idea that so those particular areas of the brain are affected. So if those particular area, like if somebody is spinning a lot, then there might be problems with the cerebellum and other things. So if somebody is having a lot of cognitive ability issues and irritability and some seizures or something like that, so those areas must be identified, and it will be done with the manifestation of the child. Basically, Through that, it will be done in the future. It is under research now. It will take a lot of time from here, at least 5 to 6 years from here.
Okay, thank you, doctor. The next question is by Ramana Murthy. Hello, sir. My child is epilepsy and LGS. Does this helps to recover my kid?
So, epilepsy in autism, sometimes because of the heterotopias, though some neurons travel to the abnormal region of the brain and they form an ectopic tissue there. From there, the signals arise. So, sometimes it may require surgery, sometimes it may require medication. So with FMT, so we have done very few cases of epilepsy. I cannot comment on that. It will reduce epilepsy or aggravate. We did not see aggravation, but the cases of epilepsy we did were already on the medications. We never tried to remove those medications, and so I cannot comment on that particular epilepsy case. Like if somebody having continuous epilepsy episodes, seizure episodes, and we never had that kind of case, and we never did FMT to that case and say that this has suppressed seizure episodes.
Sorry, just to add to it, he also mentioned that the child is 10 years old.
Yeah.
So does your opinion change because of the age?
So so for seizure episode or a neurotransmitter balance or gut inflammation, it can be done at any age, but the best time is for 7 years.
Okay. I hope that answers. Next, Umesh is asking 35 weeks or 35 days. I'm not I don't know exactly what does that mean.
No. The parent Visala was talking about her child. So she did 35 sessions till now, and
Okay.
by mistake she said 35 weeks.
Okay. So Kalaramya is asking, hello sir, how many days treatment?
Yeah. So minimum of like 2 to 3 months is needed on a regular basis because the existing microbiome is in good communication with the immune system, and it does the immune priming kind of thing. And so when the new microbiome enters, our own immune system will fight back that. So the new microbiome will face a lot of resistance for the colonization there. So every day bowel cleanse is needed, bowel evacuation is needed, and painting the colon surface for a longer period, like 2 to 3 months. So the longer the period, the survival of the microbiome, colonization of the microbiome will be there. So longer course is needed, like at least 2 to 3 months, so that the microbiome will not die and colonize, stays back and colonize and does immune priming and sustain for a longer period.
Okay, thank you, sir. Next, we go to Gopala. They're asking, doctor mentioned that it worked for many autistic kids, and for few, it didn't work out. What could be the potential reason it may not work out, and what are the things we need to take care of before starting FMT?
Uh, so the first point is like in the initial days we used to do for every case, like whoever comes with the request of FMT, we used to do. So some children responded, some children did not respond. When we look into the things like somebody doesn't have gut issues, also they responded well. So it was not the gut issues, the criteria. So then we slowly started understanding. We tried a few cases with the food intolerance test. So it actually accidentally was one of the parent did food intolerance test before FMT, and she wanted me to check again. So when we saw that, so then we understood and we tested in multiple children. So those who never had food intolerance and the blood test, they never responded. Those who have food intolerance and blood test, they responded. This became a criteria for me. So this is one of the criteria. The second criteria is during procedure. So if the bowel evacuation is not done properly, so if the bowel is not clean, and the a lot of stool will be there inside, and when we give that new microbiome, also, it mixes with that, and the new microbiome has to fight with the existing microbiome and their own immune system. So there is a high chance of failure in those cases. And if somebody is getting infections like some fecal root infection, they're drinking water from outside or something like that, eating some junk or eating sugar or some other chocolates or anything. These are some of the factors that can impact the efficacy of the FMT. So if somebody has food intolerance positive and if the process is done properly, then microbiomes are sustained there. And if they don't get any infection in the gut during this period, this microbiome will sustain for a longer period.
Okay, I hope that answers. Did anyone's Gautami is asking, did anyone seen any side effects post FMT? And the following question, no, okay, this is a different question. Sorry. We can answer this question first. Did anyone seen any side effects post FMT?
Side effects will be there because the new microbiome that we are giving that fights with the existing microbiome. So in the slides also I've mentioned the biofilms kind of thing. Biofilms made by those pathogenic microbiome, which releases those chemicals, which enters into our bloodstream and create a lot of problems like inflammatory patterns and some other issues, even the aggressive behaviors and other things. So when we are giving those the new microbiome that does a battle with that existing microbiome, when the two microbiomes have a war kind of situation, the microbiome when the microbes die, they release those contents. They enter into the system. Sometimes they show up some inflammatory pattern, some sort of aggressive behaviors in the beginning. If we do a proper bowel evacuation, this can be avoided. And another side effects that can happen is like if the donor child acquires some seasonal infection, some viral flu or something like that. So everybody's aware of the incubation periods, right? So if somebody is in the incubation period, you will not be able to notice that child is healthy. So child is healthy, but so we collect the stool and do it. Everything seems to be fine, but child is in the incubation period. That incubation, the virus or something like that, in that incubation period can transmit. So, but these are all like very small infections like flu or something simple infections will be there, like seasonal infections, flu, cold, or something like that. Some even viral fevers also. So this is the one of the major risk factor that we see, but most of the times it is manageable. And some children have hyperacidity and some rashes, and every day we are doing the procedure, some anal rashes or colic pain, this kind of which can be managed with simple medications. These kind of side effects are definitely there, but it is not there for everyone. Some children will see such kind of things, and when the pathogenic microbiome dies and releases chemicals, it induces inflammation for some time. So that also, so once that microbiome completely dies off, then these symptoms will be reduced. So, for the incubation periods and other things, what we generally try to do. So when there is, when the weather conditions or epidemics are happening, so we try to inquire about the exposures of the children. We try to connect with their school teachers and connect with parents and inquire about their exposures. If somebody is ill in their family, somebody is ill in their classroom, if they are exposed, then we refrain from doing it. So that way we can avoid this kind of thing. And proper bowel evacuation and proper methodology will reduce the diarrhea reactions.
Okay, the next question is Gopala is asking, does FMT improves the CFD condition?
Cerebral folate deficiency. Okay. Cerebral folate deficiency, like somebody has folate receptor antibody positive, they develop cerebral folate deficiency. And so autoimmunity and many other immune conditions are linked to the microbiome. So, like microbiome actually covers the entire skin and mucous membranes. It is actually a part of the defense mechanism. It is the entire immune system. Like the entire biochemical pathways are inside the skin and mucous membrane. The human body is, if you take the human body as a bioreactor, and it is covered by skin and mucous membranes. And the microbiome covers the entire skin and mucous membranes. And the immune system, 80% of the immune system lies below the mucous membranes and skin. So this microbiome is connected with, have a molecular crosstalk with this immune system. If this microbiome is disrupted, they give a immune dysregulation patterns. Autoimmunity is also taken as this one, and it may reduce CFD also. So I'm hopeful about that. I never tested somebody's fat positive and did FMT, but we are trying to bring that fat test technology to Hyderabad. We're talking to those people. We'll see in the future if somebody is fat positive and do FMT and CFT is reduced.
Thank you, sir. Umesh is asking, does FMT work for echolalia, hyperactivity, and sensory issues in ASD kids?
So echolalia majorly, since FMT will be helpful for the sensory issues. For the echolalia, you need to understand. So when we take the sound, somebody talks to us, and we take up the information. The ears take up the information to the auditory cortex and language areas and speech areas. So if the language areas are not developed properly, but speech areas are developed. If the language areas are not developed, their comprehension vocabulary will be affected, and speech areas are functioning. So if you speak something, they just utter the same word. That is echolalia. So so when we are giving the FMT, so but these languages are not properly developed, are minimally developed. So if the signal molecule expression improves after FMT, and over time, it may reduce to a little bit, but complete suppression of echolalia or something may or may not happen. So some children had that proper language areas developed, so they started understanding, and they started giving right answers in the conversation. Also, some children with, who had echolalia also earlier, but it was not consistent with every kid. It depends on the particular kid. If their language areas are developed, echolalia will be maybe echolalia may improve. If the language area are completely not developed, then echolalia may not improve.
Okay, thank you, sir. Gopala is asking two questions. The first question is, if the child is so anxious, how the fecal microbiome be transplanted to large intestine? Any sedation will be applied?
No, sedation is not required, and most of the autistic children will show resistance for a few days. It is just a position we have to keep, and we have to do it for 2 to 3 days. Then the child will understand nothing is there, and it is not painful, and we don't need to give any sort of sedation, or even we don't need a restraint also. We just have to hold the child for some time, for 2 3 days. Then they start helping in the treatment.
Okay. The next question, Gopala is asking how much each session cost. Gopala, I will personally get in touch with you, sharing that information. We won't be discussing that during the webinar. Next question is Gautami. Gautami is asking, in case child has diarrhea history and motility issue, can everyday enema will trigger again, or will it worsen in any way? As gastro mentioned, like FMT may help and sometimes may worsen, as still it's under R&D and they're not sure for success rate.
Yes, it is still R&D, but who has hands-on experience for a longer period will be able to answer this. Even if he's a gastroenterologist and never tried FMT, they will not be able to comprehend, or they will not be able to. Maybe theoretically they may comprehend, but if you don't see, if they never tried that particular treatment, they'll not be able to give a precision answer. So we have seen multiple children with diarrhea patterns also. They have improved gut motility issues. And FMT was actually first tried for the fulminant diarrheas in the China. So it is started for the people who are dying because of the fulminant diarrheas. They tried this treatment. So it has improved. And we, whenever see some, even during FMTs also, some child drinks water for some tap water or something like that, develop diarrhea. When we give FMT and that settles down. So this kind of FMT is actually it works like an antibiotic as well. So the gut microbes produce better antibiotics than the man-made antibiotics, and you can see in the aquaculture also, in export quality prawns culture and everything. There they use probiotics instead of this. Nowadays there is a restriction of the pesticides and antibiotics usage in the aquaculture, so they use probiotics for that because these bacteria are important for they produce better antibiotics than the man-made ones.
Thank you, sir. Next question. Gopala is asking, after many FMT sessions, if the child gets sick or exposed to any environmental toxins again, whatever the microbiome formed by FMT will go away and kid can regress?
Yes, if the diet is very bad and if they get a very bad infection, it can go back to zero. So that's why maintaining bowel cleanse and maintaining diet and staying away from the infectious sources is very much needed for some time. So people do a 2 3 months of treatment, and that has to be kept safe for next 2 to 3 months. So when that next 2 3 months is kept safe, then automatically that microbiome survives and it makes a strong connection with the immune system, and that stays forever. So first 2 3 months after FMT is very crucial. During that period, we should not go to the places where the chance of high infection is there, or give a bad diet, or and children are taking chocolates or junk food or anything, and the bowel cleanse is not maintained properly. Then there is a chance of going back. So it is very crucial. It's not easy to transform the gut bacteria, entire ecosystem. So because the new existing microbiome is very strong, and it has made its place there, this new microbiome has to colonize and fight and colonize against that bad bacteria, strong bad bacteria. So it has to fight with that and kill it and make its own place. And it is like it has to invade the new their kingdom. So we have to facilitate that. So we have to starve the bad bacteria, feed the good bacteria, and give the good bacteria there, and do a long course of sessions and maintain it for some time. Then only you will get a success. If we make some mistakes like eating sugar or junk food or anything chemicals pesticide containing food, then we automatically lose the microbiome. So the new microbiome is in a battle, and we need to support that for its survival. If we don't do that, we lose that entire time and effort.
Okay, so but sir, once the child starts showing the improvement, and for the short period of time, as you prescribed, like maybe for 6 months or a year, they have to be very strict in
Yeah.
terms of the diet and everything. But if during that process, child will gain improvements, symptomatic improvements in terms of sitting tolerance and other things. So that won't regress if any kind of sickness happens in future or any environmental toxins.
So yeah, if the microbiome survives and colonizes there and makes its own place there, then it can tolerate the infections.
Okay.
So yeah, it can tolerate the infections. If the microbiome survives there, it improves the detox process as well. So when the detox process are improved, automatically the chemical exposure also can be dealt.
Okay, all right, fair enough. So basically, in the short run, you have to really be very careful and very strict with everything, the food that goes in and the environmental that is being maintained around the child. And once the microbiome has formed their place and colonized there in the gut, so then you can always have new exposures. Correct.
Yeah. Yeah.
One next question is actually next it's a feedback. Vijay is saying that he attended our health camp that we conducted in Vijayawada,
Okay.
and with his for his daughter who's mild autism, and you had prescribed certain tablets
Yes.
to try on, and they've got very good response, and they are appreciating and they are saying thank you to you
Yes.
for all the guidance.
Okay. Thank you, Vijay garu.
Yeah. Next question. Umesh is asking, will FMT helps in reducing unnecessary laughing in ASD?
Yes, it improves. So it completely sometimes it gets completely cured also. Like unnecessary laugh and all these things will improve because it's all because of the neurotransmitter imbalance. And neurotransmitter balance is linked to the gut microbiome. If the gut microbiome is transformed, then automatically these kind of things improve. And sometimes candida infections and yeast infections, whatever the infections, fungal infections also can trigger this kind of unwanted laughing. So all SIBO and other fungal infections or H. pylori, all these are opportunistic pathogens. When they have, when there is an immune dysregulation, all these can colonize there and create a problem. So when you transform the immune system by doing gut microbiome transplant, all these infections can be taken care. And if you eradicate those infections, yeast infections and other things, automatically these kind of unwanted laughing and everything will go.
That's about it. We have one parent who would like to share a quick feedback. One second. I'm just trying to. Give me a moment to just quickly go into the settings, please. Vidhi, just give me a moment. I will ask you to, I'll send the request. I'm sending the request to unmute you. Vidhi?
Hey everyone, can you hear me?
Yes. Now we can hear you. Thank you, Vidhi,
Okay,
for joining us.
sure. I was not able to stop myself
No, you're
giving my
most welcome
feedback.
to share your feedback. Thank you so much for joining us. I'll keep myself mute.
Sure. Hey everyone, this is Vidhi here, and my son is 6 years old. And hearing all this, I was not able to stop myself giving the feedback about the FMT. So we are located in the US, but we especially came for this treatment to India, and we stayed in Hyderabad for 6 months. My son has taken 110 sessions. Sir suggested after his intolerance test, generally sir suggests how many sessions are required. Sir suggested us 90 sessions, but we were so happy and hopeful with this treatment that we went beyond. And to be very frank, I mean, we believe in, like, whenever we come to India, definitely we'll come for more sessions, as it was really helping. um, I mean, the team is very, very helpful, very transparent. Sir explained us a detailed treatment, which give us really trust. In terms of improvements, if I'll tell, I think two moms have already shared, so I don't want to take more time. We really saw a good improvement. My son was not having any attention or eye contacts, which all improved. He understand almost 80-90% commands of mine, and it's a slow process. I mean, you cannot see, to be very frank, you cannot see a complete recovery in a month, but we literally see the improvements. The one thing I can definitely say, the diet is the most important in this case. I mean, how much you continued with a strict diet, that helps. After the treatment, we went through the again intolerance test, and we saw improvement literally in the test. Like, there was a lot of food which was intolerance to my son, but after the treatment, when we did this test, it was really we saw a improvement with in that report. Again, there is no loss in doing this, parents. This treatment is also painless. Once you first time when you hear, every parent feel, oh, my son is so hyper, he'll not do the enema or FMT treatment. But I was there personally, 6 months. I have seen so many kids. It's just a matter of 3 or 4 days, but kids get settled easily, and no sedation or anything is required. I have seen many kids, and there was not a single kid who was having a problem with this treatment. One thing is like earlier is the better. As as the kid grow, I think, I'm not sure, but with the early age, this treatment is really um, helping. Uh, and the last thing I mentioned, like, definitely every parents have seen the improvement. But one thing I remember some mention when we were there is like, even if you see a very less improvement, these kids, once they grow, like 12, 15 years, their gut becomes so bad with all those bad bacteria, that it is difficult to, control. So that's where this treatment is also helping a lot. Uh, just like quick feedback I want to say, we really had so a lot of positive things in my son. We took a therapy. It was really intensive. 6 months therapy was really, I mean, good. So in a way, treatment, therapy, school, everything at a one place. It is a very good setup. Thank you so much, sir, and Just Bless team. And thank you.
Yeah, thank you, Vidiji, and thank you, Nupurji and Vishala garu. Thanks for sharing your feedback.
Yeah, thank you so much, all the parents, for sharing your feedback. Gopala, my name is Siksha. You can see me, and you already have my number. I had sent a reminder message to everyone. I will get in touch with you and take the consents of the parents first, and I'll be the coordinator in connecting the parents and you together. If you want any further information from them as a parent, I'll definitely do that. Uh, one more question, sir, for you. Soumya is asking, right now I cannot travel to India, but I'm wondering if there is anything can do before we can travel. Anything she can do that before she travels.
Yes, so that's where the Gut Quest program comes into the place. Like you can do a food intolerance test, proper food intolerance test, and microbiome test. Based on that, we can formulate, like we can classify inflammatory foods and non-inflammatory foods for that particular child. So in general, we say these foods are inflammatory, those foods are non-inflammatory. It is a generalized approach, but it is not so. So it is actually individualized. Every child will have a different kind of inflammatory patterns. So we have to identify those inflammatory foods and non-inflammatory foods using food intolerance test. We have to group up that non-inflammatory foods. In that, we have to identify low FODMAP diet foods. In that, we have to look for the foods sensory friendly for that particular child, and with those limited number of foods, we need to design a proper diet plan with a balanced nutrition, and we need to give some good probiotics which are needed according to their microbiome test, and this can help them to some extent, and it may not be as effective as FMT, but it will definitely help them to some extent. If you are unable to do it at any point of time, also you can continue it for the years.
Thank you, sir. I think, does anyone have any other questions? You can send it right now. We can wait for like a minute more. And otherwise, the next set of line is I will get in touch with you. Myself, I'm introducing myself. I'm Siksha, and I'm one of my colleague. Her name is Bhavani. She will, either me or her, one of us will get in touch with you for any of your further queries, and we'll be able to provide all the further assistance. I will be sharing an email and a message as well for you guys to be able to connect with us. Yeah. Okay. I think, sir, we can conclude now. Most of okay, sorry. We've got one last question. I think it's the most famous and trending question now because of the Trump. Is it related to leucovorin treatment anyway?
So, leucovorin works for any child with autism, and not only autism. It will work for psychiatric disorders. It will work for neurological disorders. Leucovorin is a form of the folic acid. Folic acid is an essential supplement. Folic acid helps in DNA repair, and it will combat the oxidative stress as well. Though the child is a frat positive, frat negative, don't worry about it. Use folinic acid. Leucovorin is definitely will work, and you can give in combination of with methylcobalamin. So that's a good combination. Give a methylcobalamin and folinic acid together, then child will improve to a good extent. And the Vijayawada parent also have suggested this. So before Trump's announcement, only this happened. So we gave methylcobalamin and folinic acid along with two probiotics, VSL3 and lactobacillus reuteri that is extracted from the breast milk, the protectis one. And we gave detox medicine like N-acetylcysteine and gut evacuation. For gut evacuation, we have given polyethylene glycol. This was a simple approach. I have given these 5-6 step medicines for every child in that particular workshop. So this will work for any, this particular combination will work for any child.
All right, we'll conclude for today. Thank you so much, sir, for for the webinar, for the information, for the question answer, for everything. And anyone has any further questions, like I said, Bhavani or myself will be in touch and we'll connect you with sir, with the parents, with anyone you want. Thank you so much, everyone, for participating.
Yeah, thanks for all the participants. And we'll conclude the webinar here.
Yes.
Thank you very much.
Thank you.
Thank you.